Welcome, everyone. This is Pam and Linda with Your Nurse Advocates Consulting, and we are talking today about a trip to the ER. Linda's had an experience with her dad, and I have had many experiences that we'll share and just kind of give you an idea of what it means to go to the ER, what kind of treatment you're going to get, what aren't you going to get, what might be covered, what might not be covered. So we're going to get into a lot of the details about taking a trip to the ER. So Linda, do you want to get us started?
Yes, thank you. It used to be years ago that you could walk into an ER and the ER would kind of just take care of everything. Well, that is not the purpose of an emergency room or an emergency department. It is truly for emergencies. It does not replace having a primary care provider, whether that be a nurse practitioner, a PA, a physician, and having regular checkups or getting your vaccines or immunizations or your overall general health care, at your doctor's office. The ER is not the place for that. The ER is not the place, and it does not replace your physician's appointments. The ER is there for emergency care only. It is not set up to deal with those general public issues. There is other entities that you can utilize, such as urgent care. So you have your primary care physician office where you can make regular appointments, develop a relationship with a primary care provider who knows your health status and can treat you appropriately. And then for those issues that arise that do not require an emergency room, you have urgent care. Urgent care will deal with things such as strep throat, back strain, knee pain, flu-like symptoms, different types of short-term abdominal pain, things of that nature that don't require an emergency room or that are not serious enough to be in an emergency room. You can go to the urgent care.
Like earaches for the kids,
earaches, yes, sore throat,
sprain your ankle, yeah.
Yes. Yes, those are the things you go to the urgent care for. The emergency room is set up for people who are true emergencies, who have been in a car accident, who have significant chest pain, who have abdominal pain, who have things that are life-threatening, is where you would need to go to the ER. So when you go into the ER, or when you're brought into the ER, even if you're brought in by ambulance, you're triaged. Triage means that the nurse and or a PA will come out and they will take you into a room and they will triage your symptoms to look at the severity of your symptoms. Do you need immediate care in the emergency room? Are you a priority status, or can you wait? Because the emergency room is designed to deal with priority status patients first, people with life-threatening conditions first, people who are severely injured, who are significantly sick. They are the priority. So you could go to the ER for treatment, even with an ambulance, and sit and wait in the ER for anywhere from an hour to 2 to 3 hours or even longer before you're seen. So you need to be aware that just because you go to an ER, if you are not a priority, significantly or seriously ill, you may not be seen right away. They will triage you, you will be put in a queue, and you will wait until they have a room open or the priority statuses of other individuals change before you're seen.
I do want to well, I just want to say one thing, Linda, especially coming from a rural area, your urgent care might be in the same hospital that has the emergency department.
Correct.
So it's important when you go in is they'll ask you, are you here for emergency or are you here for urgent care? And there's different charges for that. So if you're there with something that's not life-threatening, you need to get it checked out, maybe you cut your finger, you might need a couple of stitches. You want to make sure that you say that I'm here for urgent care. Now, in the emergency room, they may have different hours for urgent care. So if you go at 1 o'clock in the morning, you may not have an option of being able to ask for urgent care. It may be all emergency, but I just don't want you to think that, there's a special place. There are some standalone urgent care centers, or some clinics have urgent care hours. But I just wanted you to realize that, a lot of times that a hospital with an emergency room will also have an urgent care, along with
Right,
it.
and
You may
it
be in the
actually,
same bed or same room, but you're going to be
Mhm.
assigned to urgent care.
Right, and you may actually go to the same reception area, and at that area, they will look at you and say, are you here for this? And they'll send you, and one sign will say urgent care here, emergency room here. And based on the information that you give, or your loved one or whoever brought you in gives, will determine whether you go to the emergency room or the urgent care. And a lot of it will depend on the type of things that they actually can do in that urgent care, and the types of providers that they have in the urgent care. Some urgent cares will do x-rays, others will not. Some urgent cares will do EKGs, others will not. So you need to know what the level of your urgent care is and the types of providers that are in those urgent cares, especially in more rural areas. So, and Pam is right, there are freestanding urgent care centers where you can go to, and then there are also freestanding emergency rooms, or what they call independent emergency rooms that are part urgent care on one side and emergency services on the other. They are part of a hospital system, but not directly connected to that system. Just as they have freestanding surgical centers, they're now having freestanding emergency rooms. One of the things that's important to understand about an emergency room is, once you get into a room in the emergency room, one of the things that they're going to do is they'll probably put your loved one on a monitor, put you on a monitor, take a look at what needs to be done. They'll have a board there that should identify the nurse, that should identify your PA or mid-level provider, which is your nurse practitioner or your PA, and also who the emergency room physician is who is working that shift. Now, if they're real busy, even though you're in a room, doesn't mean you're necessarily going to be seen unless you're actually a priority, life-threatening type of serious illness. The rooms are, just so you know, that the emergency rooms are cleaned in between patients. They're, everything is changed. So they have to turn the room over before they can bring anyone else in there and make sure it's clean and appropriate, especially with, our infection control around COVID. So you will also be given a COVID screening when you go in there. They will ask you specific questions. They won't necessarily test you for COVID unless you are symptomatic COVID, to where when to the emergency, or if you're ambulance, the ambulance company will give you a mask prior to getting into their ambulance, because once you hit that hospital door or that emergency room door, you must be masked. So, and you'll have to keep your mask on at that whole time. The emergency room is really there to treat the acute illness that is going on at that point in time. They are not there going to be treating long-term or chronic conditions, except for what we call acute exacerbations. So if you have asthma, what they're going to do is they're going to treat that asthma attack. They'll give you nebulizers. They'll listen to your lungs. They may start you on steroids. They may do all of those things for you, but they're going to tell you at the end of the day that you're going to need to follow up with your primary care physician within a certain time period. At the end of your ER visit, you should be given a set of discharge instructions. Sometimes they're very lengthy, and if you don't understand them, you need to ask them to go through them with you very carefully, so that you understand the expectations of how you need to follow up on what has happened, because they're not going to cure you in the ER. They will manage your symptoms. They will control your symptoms. They will give you pain medication or antibiotics. They will take care of those acute issues at that point, but they're not necessarily going to provide extensive follow-up. The only way you will get extensive follow-up is if you have the life-threatening illness. They admit you, they take you to surgery, they bring you up to the ICU, they take you to the cath lab, or they do what needs to be done for those emergent, life-threatening situations. But if you're there in the ER because you have a broken arm or because you have abdominal pain, they'll do the appropriate testing to see what's going on. They'll treat you, but then you're going to have to go for follow-up, and they should give you the name of the GI doctor or a doctor to take care of your kidneys or your heart after they've taken care of those acute things. But it is your responsibility to manage your health care to be able to follow up once you leave that emergency room. You need to make those appointments with your primary care provider. Let them know you've been seen in the ER, that you need a follow-up appointment. Make the appointments with these follow-up providers for a GI specialist or a kidney specialist or a heart specialist or a lung specialist. You need to make those appointments and get in there. And usually when they tell them that it's a post ER or hospitalized visit follow-up, you can get in sooner than if you were just calling and saying, I need to have an appointment. My doctor says I should see you. So if you were at a routine physician's appointment and he recommended it and you needed to follow up with someone, it may take you longer to get an appointment versus the fact that you were in the ER. Those visits you seem to be able to get into sooner than later. So you need to make sure you follow up. You need to make sure that you read your discharge summary carefully, that if you have prescriptions, that you take them and get them filled, but that you understand how to take the medications that they are prescribing for you when you leave the emergency room. You need to understand how often you take them, what you're taking them, and why you're taking them, and then for how long you need to take them. You need to make sure you understand any dietary restrictions or any dietary changes. You need to understand that if they say you need to be off of work for 7 days, that if your employer requires a return to work or a notice that you cannot work for a certain period of time, that you get that from those physicians in the ER until you can go be seen by that orthopedic doctor or by your primary or whatever specialist, and then they can change or enhance or differentiate those return to work notifications. But you need to make sure that as a person going to the ER, that it is yours or your family's responsibility to be responsible for your health care. It's not just up to the emergency room. They're not there to cure. They are there to save lives, and they do save hundreds of thousands of lives every single year as people enter the emergency room with life-threatening situations. They deal with life and death all the time in the emergency room. And Pam and I can attest that we both have worked in the ER for periods of our career. And the ER is a very, very highly stressful, highly rewarding environment to work in, but it really deals with life-threatening situations. That's what they're there for. That's why they prioritize care in the emergency room, because they do have to deal with those life and death situations first before they deal with the others. Doesn't mean you won't get care, but your care will be prioritized. Pam, do you want to add anything?
Yeah, I just want to, Linda is dead on with everything that she said. Really there's a lot of good wisdom there. And if you are ill enough or you are sick enough, obviously you will be admitted to the hospital. I mean, and the emergency room physician will contact the hospitalist or the admissions doctor at the hospital, and they will consult with them, and together they will determine whether or not you need to get admitted to the hospital. One of the things that I did want to bring up is sometimes we have what we call social admissions to the ER. Maybe you have an aging parent or a grandparent or someone that's, not, maybe is not taking care of themselves as well. And you figure if you bring them into the emergency room, they'll figure out a way to find them, to put them in a nursing home or get them some help or that. And that is a very, very difficult and challenging situation for the ER, because Medicare, they do not cover custodial care. And what I mean by that is if someone comes in the emergency room and there's not a medical reason for them to treat, all accept that they're not caring for themselves at home and they need someone to give them a bath. That is not a covered service. We can't admit a patient for those reasons. So now we've put the emergency room staff in a very precarious position. A lot of times the social workers will be called into the ER or the social worker assigned to the ER to try and help, facilitate getting them somewhere or putting a plan in place so that they can safely go home. But it's not, please don't assume that you can bring them in and they're just going to get admitted for that, because it's not a covered service. So if you find that you have a loved one is in that situation, please try and reach out to your clinic, because they have social workers and the nurses, and they can look at being proactive and put a plan in place that you can do a lot more Monday through Friday between 8 and 5 than you can do on a Friday night at 9 o'clock at night. So it makes it very, very challenging. But that was one of the things I did want to mention about the ER.
The other thing I want to mention is that if you currently have home health and or hospice, before you go to the ER, or if you decide your symptoms require the ER, please call your home health provider first and take direction from them. And they need to be aware if you're going into the ER, because they need to follow up with the ER in regards to giving them report, making sure that they understand the medications you're on and why you're being treated or why you are getting home health. It's the same with hospice. If you have a loved one or you are in hospice and you decide you want to go to the ER, please contact your hospice provider first so they can contact the ER, and they can make sure that the people in the ER know that you are a hospice patient, and they can decide whether the ER is the appropriate place for you, and or whether you're going to continue with hospice, or if you are deciding to revoke hospice. But you please contact your home health and hospice providers first before you go to the ER.
Great point. So I think that's all we have as far as a trip to the ER. Linda, was there anything else you wanted to add with your most recent experience with a parent?
Yeah, I think it's, a lot of times when we have, my dad required going to the ER recently, and he's older, he's 90, and when he gets upset, he was taken in by ambulance. And when he gets in there, sometimes because of everything that's going on, they can get confused. They're not always the best historian. So it's really important that your parent have on them, or your loved one or whoever has on them, a card saying, please contact this person. They are my power of attorney, or I defer decisions to them when I'm in the ER. Make sure they have with them their wallet with their insurance card and contact information, especially if they're going to an ER where they may or may not have all that information on file. It's also important that if they can, have a copy of their current med list with them in their wallet or in their pocket that they can access, that can go to the ER with them. A lot of times what we see, or what I have seen through my experience in the ER and home health and hospice, is that a lot of times people are seeing 3 and 4 and 5 different doctors, and their medication lists are not always updated in the hospital database. So by having that current med list, it can be brought to the ER, they can update it so that they know what medications this individual is on, so they can treat them appropriately. So I made sure that my dad had a copy of his med list with him. I made sure he had my contact number, so that when that physician called me from the ER, I was able to speak with them, and they already had a lot of the information that they needed in regards to medication and his diagnosis, and what was going on with him. It also helped that he was going to a hospital, an ER system that shared information through Epic, which is their EMR system, with other hospitals. Some share information, some don't. Sometimes there's a firewall. So even though they have Epic, they may not have access to all of the medical records. So it's still really important that there's contact information and a current med list that goes with the individuals. My dad he went there in the middle of the night, so he was confused, he was forgetful, he wasn't really sure what he needed to ask them for. He wasn't really, he had so many things and so many people talking with him at the same time, he didn't really know. So he needed to be calmed down so that he could speak rationally and appropriately to the staff that were providing care for him. And then they called me and I validated the information. So it's really important to make sure that your elder parents have the information on their person or easily accessible to emergency services or accessible to them if they have to go to the emergency room.
Excellent, excellent point. So I think we've covered a trip to the ER pretty well. If please reach out when you watch this video. Don't hesitate to put a comment in or ask a question. We'd be very happy to answer that for you, or also put a comment in if there's a topic, regarding, healthcare that you would like to learn more about. Linda and I'd be very happy to do a video for you. So with that being said, thanks for stopping by and taking time with us. Take care.
Bye-bye.
Okay, good job.